cerebellum in our plastinate, we can discuss the parts of the vermis right here. No? Vermis again is the constricted midline part of the cerebellum. So adherent to the roof of the fourth ventricle right there, that's the lingula, followed by the central lobule. Then we have this large mass right here, which is the culmen. This one is the primary fissure. Then we have the declive, horizontal fissure. We have the folium, the tuber, the pyramid, no? And then we have the lingula. Lateral to the lingula is the tonsil, cerebellar tonsil. And then the last structure right here, that's the nodule of the flocculo-nodular lobe. As you can see, the cerebellum occupies the posterior cranial fossa, no? And the superior and posterior aspect is flat, no? Right above that is the tentorium cerebelli. So anterior to the cerebellum is the cavity of the fourth ventricle. So I think in the previous video there was some discussions regarding the cerebellum, but unfortunately it was cut because of the size limitation, no? Of the hard drive of my cell phone, no? When I was recording that video. So the cerebellum is important for coordinating, no, the contraction movement of different muscle groups in our body. So with a functional cerebellum, no, we can do smooth, no, coordinated, purposeful movements, no, including movements that we unconsciously, no, we find very simple movements like walking, no, but with cerebellar dysfunction we cannot gracefully or purposely walk, no, without any problem, no, if we have cerebellar dysfunction. So our best one example, no, which I usually give to illustrate, no, or to point out, no, cerebellar dysfunction is the movement, no, of an intoxicated person, no, movement of a drunk person. So there will be loss of coordination, no, even walking, no, which is supposed to be a very simple and straightforward act or movement. A drunk person, no, will have difficulty in walking, no? They cannot walk in a straight line, no? And they cannot execute, no, the rhythmic, no, graceful gait movement, no? Simple movements like putting one foot in front of the other, no, they will have hard time doing that, no. So much more, no, if you ask them to write, no, words on paper, to play the piano, or even simple movements, no, like if you ask a drunk person, no, to touch the tip of their nose, no, with their index finger, no, they will sometimes, no, miss, no, their mark, no. You ask them to touch their right eye with the tip of their middle finger, no, they cannot execute that properly, no, smoothly, no, especially if they are drunk or intoxicated, no. Even balance, no, they will have balance problems because the cerebellum again it is involved in coordination, no? So maintenance of balance and posture, that involves coordination, no, between or among groups of muscles, no. The mere process, no, of standing upright, no, you should have well coordinated, no, contraction, relaxation between muscle groups, no. Some muscles need to contract, no. The degree of contraction is also important, no. Some muscles need to relax, no, and the degree of relaxation is also important, no, so that posture, no, and balance can be maintained, no. So if you have patients with cerebellar tumors or lesions, no, they will behave, no, like a drunk individual, no. Even when they speak, no, there will be slurred speech, no, because speech needs coordination, no, between or among groups of muscles, no, that move the lips, the tongue, no, the jaw, etc.